Greetings. Today I'm going to present to you our poster titled Meduloblastoma during pregnancy, hormone-mediated association, through the report of a case and a review of literature. Meduloblastoma is the most common malignant pediatric brain tumor and a leading cause of cancer-related death, accounting for 10 to 20% of brain tumors in children, but are observed infrequently in adults, accounting for an estimated 1% of primary CNS tumors in this population. Approximately 70% of patients are diagnosed before the age of 20, and there is a slight increase in incidence between the ages of 20 to 24 years, and the disease is rare after the fourth decade, consistent with embryonal origin. Tumors during pregnancy are not uncommon, but primary brain tumors in coincidence with pregnancy are unusual, and the incidence of medulloblastoma in pregnancy is still rarer. The clinical course of this tumor is often rapid, with prominent symptoms of increased intracranial pressure and cerebellar dysfunction. Medulloblastoma comprises a biological heterogeneous group of embryonal tumors of the cerebellum. Being a primitive neuroectodermal tumor, it is now considered to originate from not only cerebellar external granular layer precursors, but also ventricular zone and dorsal brainstem neuronal progenitors. On a molecular level, medulloblastoma can be divided into 4 distinct subgroups with distinct cellular origins: genetics, clinical behavior, and patient outcomes. Initial indications for a role of estrogen receptor in medulloblastoma came from studies showing that cerebellar granule cells can respond to stimulation of these receptors, and therefore the association that high levels observed during pregnancy can be a contributing factor for the appearance and growth of medulloblastoma in predisposed women. The present case is one of the 2 reported in our institution. The patient was a 21-year-old woman in the 13th week of gestation of her first pregnancy that was admitted with a 2-month history of headache and gait disturbance with right hemiparesis and dysarthria. On physical examination, impaired coordination associated with the cerebellar ataxic gait was observed. The initial MRI showed a posterior fossa tumor in the right cerebellar hemisphere. The patient was scheduled for surgery with the intention of achieving total macroscopic resection of the tumor, and the pathologic report revealed malignant cells consistent with desmoplastic medulloblastoma. The patient did well, but after 6 months, follow-up MRI showed tumor recurrence, and the patient required new surgical excision. It's noteworthy that the patient continued her pregnancy after surgeries, ending a 37-week by cesarean delivery without having received radio or chemotherapy by her own choice, until after 1 month post-delivery, when she completed a adjuvant therapy scheme. 1 year after the last surgery, follow-up MRI showed no tumor recurrence, but subsequent bone marrow biopsy due to pancytopenia showed complete replacement with metastatic medulloblastoma with no residual hematopoiesis. The patient cursed with torpid evolution, dying at the 3rd year after diagnosis. In a literature review, we found 8 cases of medulloblastomas diagnosed during pregnancy, with an average age between 20 and 30 years, and a higher frequency of presentation during the 2nd and 3rd trimesters of pregnancy. In 2 cases, metastases to the bone marrow and spinal cord were reported. For several years, it has been studied and proposed that hormonal changes and increase in the levels of growth and androgenic factors during pregnancy influence the rate of growth of brain tumors. This is true not only for medulloblastomas but also meningiomas or glial tumors. It has been demonstrated that like granule cell precursors and mature granule cells, malignant medulloblastoma cells express estrogen receptor beta, and estrogen can regulate growth rate and migration in normal granule cell precursors and medulloblastoma cells. In a series of studies, Belker reported that elevated levels of estradiol can increase the resistance to chemotherapeutics used to treat medulloblastoma, and that blockade of estrogen receptor activity inhibits this effect. Those studies also reveal that estrogens and estrogen receptor activity played an important role in medulloblastoma, and suggest anti-estrogen therapy as a potential adjuvant to current chemotherapy used to treat this condition. The uniqueness of these cases is their rarity. The symptoms are usually masked by the symptoms of pregnancy. The radiological report and the general characteristics of the meduloblastoma may be similar to other CNS tumors. At present, there is still little evidence regarding the pathogenesis and treatment of meduloblastoma in pregnancy.